Good afternoon. Welcome back to our webinar series entitled Frontline Report, Autoimmune Liver Disease and the Pandemic. This series of webinars are made available via collaboration between the Autoimmune Hepatitis Association and the Center for Autoimmune Liver Disease and Cincinnati Children's Hospital. I'm Craig Lammert, the Executive Director for the Autoimmune Hepatitis Association. I'm also an adult hepatologist at Indiana University. I'm excited to welcome you to the 7th webinar in our series. This special webinar is an Ask Me Anything conversation with Dr. Krutika Kuppalli. If you watched 2 weeks ago, we introduced and interviewed Dr. Kuppalli, who is an infectious disease specialist and public health expert in California. During that webinar, she reviewed the risk of acquiring the novel coronavirus infection during some of our favorite summer activities. She also reviewed and encouraged us to take inventory of our own individual risk factors that may increase our risk of a severe coronavirus infection. During today's webinar, we have compiled a wide range of questions from our members with autoimmune liver disease that include both pediatric and adult-focused topics. Moderating our discussion today will be Christine Browner and Aaron Anderson. Mrs. Browner is a strong advocate for pediatric autoimmune liver disease research and education through a number of organizations, and Aaron is the AIHA's Director of Programs and Advancement. Before we jump in today, I want to quickly review a disclosure from the AIHA. This webinar series does not replace your primary physician, gastroenterologist, or hepatologist. We cannot diagnose, treat, or manage symptoms associated with AIH. As a part of our online series, I often add snippets of research findings that are off topic from the webinar theme, but are timely for autoimmune liver disease patients in the COVID-19 era. This week, I want to review a study published this past week reporting features of COVID-19 among autoimmune hepatitis patients in Italy. Despite being a small group of AIH patients, I think there's information here worth reviewing. Certainly, immunosuppressed patients and doctors alike have struggled to fully understand the risk of immunosuppression and impact on disease severity of COVID-19. This study collected information on 10 AIH patients, all being diagnosed with COVID-19 in March 2020 from 7 different hospitals in Italy. 7 patients were female, had age ranges from 27 to 73, and half had known cirrhosis or advanced scarring of the liver. All patients were on immunosuppression, including 90% using prednisone, and 8 of the patients had normal liver tests prior to the coronavirus infection, and all had respiratory symptoms at presentation. 4 of the 10 were able to stay home and recover. Among the 6 that needed hospitalized for symptoms, 5 of them developed COVID-19 pneumonia. In 7 patients, treating doctors made adjustment to immunosuppression treatment. Liver tests for all patients remained stable during observation. At time of the published report, 9 of the 10 patients were alive and had recovered. The patient that died had a history of cirrhosis, but complications from cirrhosis, including a history of hepatic encephalopathy and ascites. I think this finding emphasizes the point that we believe patients with cirrhosis likely have increased risk of worse outcomes with COVID-19 compared to those that don't have cirrhosis. But reassuringly, the authors of this study concluded that the AIH patients in the study seem to have a disease course presumptively similar to that of a general population without autoimmune hepatitis. And with that good news, I will hand it over to Christine Browner, who will reintroduce Dr. Kuppalli. Thanks, Chris.
I would have the privilege and honor to introduce Dr. Krutika Kuppalli, who is the infectious disease physician and vice chair of the Infectious Diseases Society of America Global Health Committee. And I had the privilege of interviewing Dr. Kuppalli a couple weeks ago. So I'm excited to continue the conversation. Thanks for being here today.
Yeah, thanks for having me again.
Absolutely. So this question that came from one of the AIHA members is actually really relevant to me because I have college kids. But this parent wanted to know, for those of us with college-age kids, should we be concerned about our children returning to college in the fall?
Yeah, that's a great question. I think that, there are a lot of different things that colleges are considering at this time. And I think there are a lot of different things that need to be considered with children or college age students returning to college this fall. I think that, some of the things that are being looked at is trying to decrease the number of students that'll be in each dorm room, trying to make sure that rather than having multiple people in a dorm room, having one person per dorm room. Also trying to make sure that classes may be available online, trying to make sure classes have more distance in them, so people are able to physically distance within the classes. Also trying to start classes earlier in the summer, so they students might not be able to be around each other into the winter, so they might miss the flu season, which will happen later this year. So I think there are a lot of different things that are being looked at. I think ultimately, I'm going to drive home the same things that we've been talking about for a long time. Things that we need to be thinking about are going to be physical distancing, making sure that students are going to be adamant about wearing masks, as that will help prevent spread of potentially infectious droplets, and also to be really adamant about good hand hygiene. Unfortunately, any sort of social situation, such as being in college, where they will be in close proximity, is going to be a risk for transmission and acquisition of COVID-19. So I also do think that thinking about where people are going to school is going to be something to think about. There are certain places in the country where currently even transmission is higher than in other parts of the country. So I think those will be things that we need to think about as well.
So I think you sort of answered this question a little bit, but there's a college-age student that wrote in, and she actually has autoimmune hepatitis. And so specifically for her, who may be immunocompromised, is there any special precautions that you think she should take? She said that she's not able to do online schooling because of her major, so she will be going in person. So anything specific that she should do as a patient of AIH?
Sure. So I think especially for someone who has AIH, somebody who is going to be considered in that higher risk category, I would definitely be a bit more cautious. And it's hard to give exactly specific recommendations for that particular person, because there are also other things I would be thinking about. Again, I don't know what her level of immune suppression is, so I'd want to know that. I'd also be curious as to where that person might be going to college. Again, if you want to think about how high the level of transmission is in the area where you're going to school, that would be something I'd be worried about. In addition to where you're going to school, I'd also be thinking about my living situation, things that help mediate the transmission is going to be making sure you're able to live in an area where you're able to keep potentially physically distanced. So in a room by yourself versus having roommates in your immediate room. If you're going to be going to classes, trying to make sure you're able to wear a mask, that will help protect yourself. And also making sure you're able to physically distance yourself from people while you're in classes. I would maybe try to sit either in the front of the class or in the back of the class, making sure you have good hand hygiene. And if you can, take smaller classes as well. And, if you can't have your classes be online, maybe you could also have a friend who could take the classes for you.
Those are really good suggestions. I feel like people have to get really creative right about now with how they're living. So I'm shifting gears a little bit now to the younger kids. So for elementary school, a lot of school districts are talking about all sorts of different ways of what school is going to start looking like. It's going to be, some are going back, some are online, and there are the schools that are considering more of a hybrid model where partial education is online and part is in person. So this mom or dad, I'm not really sure which one, wrote, should she be worried about sending her elementary school child with an autoimmune disease back to school?
I mean, I think that we all need to be concerned. I think we're still learning a lot about the dynamics of the disease. We're still in the early days of this pandemic. I think that that's something that we all really need to keep remembering. I know it feels like we've been in COVID-19 forever, but we're only 6 months into the pandemic. I think some of the things that people need to consider and think about when it comes to sending kids, even young kids, back to school is one of the things that we do know is that younger kids may not have as severe symptoms as COVID-19. However, you also need to think about the people that the children are around, right? So kids may be carriers for disease and they may transmit it to other people in the household that might be at higher risk for disease. Again, I think you need to think about the things that we talked about with the other people that we've discussed. Wearing masks. I know there's lots of debate going on around that, not just in communities, but what schools are going to do. I think schools around the country are thinking about different things that they might do to help mediate risk of acquisition and transmission of disease. They're working on trying to see how they can cut class sizes down. They're working on different hybrid models, trying to space out how they stagger start times for kids. They're also thinking about things like how often they're going to be cleaning classrooms and other facilities that children use. I would also recommend, trying to get your kids in the habit of using good hand hygiene and washing their hands, wearing their masks. There's a lot of different things that are being looked at as well. I don't think there's one right answer that we've all been able to come up with. I think there's a lot of debate about that right now.
You know, you bring up a good point of you have the summer maybe to practice some of these skills before the kids possibly go back, the younger ones, with mask wearing and hand hygiene. You also bring up an excellent point. I think it does feel like this has been going on forever, but in fact, we're still learning a lot about this disease, aren't we?
Yeah. I think that a lot of people feel like we've been in this forever. I know that I feel like I've been in this forever. I think my colleagues feel like we've been in this forever, but we only have known about this infection for 6 months now. And in the comparison for other infections, this is still very much in the early days of this infection, early days of this pandemic. There's still, so much that we've learned, but there's still very much more that we need to learn about this virus. I think for every new question we get answered, we have 10, 20 more questions that we have. And I think particularly when it comes to the transmission dynamics of this disease, there's a lot that we still need to learn, and also in the clinical manifestations of the disease and the long-term consequences of this disease. There's a lot of questions in terms of if I get this, immunity, things like that we just don't know. And I know the unanswered questions is a lot of what causes the uneasiness and the anxiety for a lot of people at this time. And the only thing I can tell people is the best thing that you can try and do at this time is try to do your best to listen to reputable people in the public health and infectious diseases arena, and try really hard to follow some of these tried and true recommendations that you're hearing from all of us, that we keep trying to drive home the same things, right? So physically distance, continue to wear a mask when you're out and about, continue to wash your hands, and if you're sick, stay at home and self-isolate. And I do think that this is a great time to try and reinforce those types of measures, especially for the young ones, particularly if they are wearing a mask. Really try and reinforce they shouldn't touch their mask if they have dirty hands, because that will defeat the purpose of wearing a mask.
Yes, I do that daily right now. It's hard.
Sure.
I think we talked about that last time. It's hard not to do that. What about assuming that field trips happen? What's your thought on parents with kids that are immunocompromised or have AIH, allowing them to go on field trips?
Sure. So assuming that field trips happen, I think, first off, it depends on the type of field trip. I think field trips that happen, I think that it's fine for children to be able to go on field trips. We want kids to feel included and comfortable as much as possible. Hopefully field trips that happen, the safer ones are always going to be ones that are outside, just because they're out and they're about in openly ventilated areas. I think that, again, it's hard to make broad, overgeneralized recommendations without knowing exactly the scenario. So I think, again, for any parent that's making that type of decision, you need to think about what the field trip is, how they're getting there, where they're going. Think about what your child will be doing, and think about what kinds of transmission risks there might be for your child, and what kinds of contacts they might be having. Those would be the things I would think about if I had a child in that type of situation.
Okay, it's a good reminder to kind of critically think through each situation. So right now, many grandparents are choosing not to see their grandchildren, and some are maybe choosing to see them but from 6 feet apart. And I know from my experience, I'm sure lots of people out there, it's really, really hard on the grandparents and the grandkids. One grandmother wrote in and asked when it's going to be okay to visit her granddaughter again, and if she can give her a hug. So sweet.
Sure. Yeah, that's a question I get asked quite a bit. Again, especially given the way things are going in this country right now, I would definitely recommend people to stay close to home, try to remain in their social circle. So, right now that would be your family. We're seeing cases go back up in the United States. We're having record numbers of cases the last few days. So for right now, I would not recommend people going outside of where they are. That being said, at some point when it gets to a point where it might be a little bit safer to potentially meet up with your family whenever that may be. I think there are a lot of things you need to think about. So one of those would be, as the grandparent, what is my risk factor for getting coronavirus, right? So you need to think about, okay, well, what are my comorbidities? We know that the things that put you at increased risk are going to be having advanced age, things like having diabetes, coronary disease, obesity, and other medical conditions that might cause immune compromise. So that would be one thing. The other thing would be, risk factors of your grandkids, right? So what have they been doing? What kinds of potential exposures they have been having? So, I can't give, again, this is one of those things where you have to have some critical thinking. If you're going to meet up, I would definitely plan on doing so in an outward space where there's going to be greater ventilation. Some of the things that I recommend are trying to go for maybe a physically distanced walk where you can have some space between you, or meeting up in like a backyard of either your backyard or your grandkids' backyard, where again, you can maintain that space but be around them. I think everybody has different risk tolerance. I think I really can't make that recommendation about whether or not you're going to give a hug to your grandchild. I think, again, it depends on your risk factors, your grandchild's risk factors, and how comfortable you feel. If you are going to do it, the things I would recommend are going to be the things that we've been talking about a lot. You should wear a mask. Your grandchild should wear a mask. Use good hand hygiene. And you should turn your head one way and your grandchild should turn their head the other way. That would probably be the safest way to do it. I'm not going to advocate for that one way or the other. I think you really need to think about what that would be. We do know that the longer time you're in proximity with each other and the more infectious somebody is, the greater risk there is of transmission. So, I don't advocate for these things, but I know that people are doing them. So we know if they're going to do them, we want them to do them in the safest way possible.
Yeah, these are really, really hard issues. And seems to get harder and harder as time goes on.
Right,
so,
right.
Yeah.
Yeah.
So I know we talked a little bit about this during the last webinar, And for those of you who haven't seen it, I would definitely recommend going back and watching it. It was really engaging. But parents are still wondering, I should say, about how to balance the risk between their kids' needs for in-person social interaction and then, protecting them from the coronavirus. So do you have any additional thoughts on that?
So, well, I think that's a great question, and definitely agreed that, children need to have some sort of social interaction. And I've, tried to think of things that people can do that are outside the box and creative. And I think it's hard. And again, with cases going up in this country right now, I definitely would not recommend people going out and about and engaging with other people. But I think that there are ways that we can try to be creative with our friends. One of the things that I've tried to recommend with people is doing things like having game nights or things like that using our electronic devices. One of the things that I've done in the past with friends of mine when I've been in other countries is playing things like Words with Friends with friends of mine that were maybe here in the United States and I was in another country. And I think those are ways to remain socially connected, but maybe you're not, actually physically in the same spot. The other thing you can do is maybe having like a physically distant movie night where you guys all agree to be watching the same movie. So not ideal, but again, thinking outside of the box right now.
Great. Thank you, Dr. Kuppalli, for all these suggestions and for your input on how we can keep ourselves and our kids safe during this time. And I think Erin has some questions that she's going to be asking you regarding more adult specific. So I will pass it on to her, but thanks again.
Yeah, you're welcome.
Thank you, Chris. Hi, Dr. Kuppalli. It's great to see you again.
Yeah, great to see you. Thanks for having me.
Thank you for being here. My family and I have been finding your tips from the last webinar really helpful. We're taking a road trip later this summer, and we've been doing quite a bit of planning over the past couple of weeks. And I found myself thinking back to the last webinar as we've been discussing details like eating out and places we'll stop along the way and what activities we might participate in and ones we might consider skipping on this vacation this year. It's been a struggle, I think, to figure out how to navigate COVID-19 in our everyday lives. And I think that's evident by the number of questions we've received from patients for today's webinar. So let's go ahead and jump back in. Since the last time we spoke, quite a bit has changed. States like Texas and Florida have seen dramatic increases in the number of COVID-19 cases. Should other states across the country expect to see similar increases?
Yeah, that's a really good question. I think that definitely over the last few days, we've seen case numbers go up, not just in Texas and Florida, but really in a number of other states. And I think that that is something that we definitely need to keep an eye on. I think there's been some debate, depending on who you listen to, if those increases are just due to increased testing or if it really is an increased number of cases. Looking at the numbers, I think that it is due to an increased number of cases, which isn't necessarily unexpected with us lifting public health measures. And we're seeing cases go up in South Carolina and in Arizona and even here in California and other parts of the Southeast. And I think that's a really important thing to think about, especially if you are, as you mentioned, planning some summer travel. You really want to think about not just where you live, but you really need to think about where you're going, because where you go and what you're going to be doing is really important, because that could put you at risk for getting infected, and then you could get sick where you are. Alternatively, you could get infected where you are and bring coronavirus back to where you live. And so those are all really important things to think about. And so before you travel, you should be paying attention to what's going on to where you're going to go, because you don't want to get sick.
Mask use is another important consideration, I think, on vacations and just everyday life right now. And we talked a little bit before about use of masks in schools, but just curious what the current most up-to-date recommendations for mask use are.
Sure, that's a great question. So both the World Health Organization and the Centers for Disease Control and Prevention recommend wearing a cloth face covering or a mask. And this really is for one main reason, is that given the current state of the pandemic, we really need to assume that everybody has coronavirus. And so what that means is that because we assume everybody has coronavirus, then we assume that everybody's droplets are potentially infectious. And we want to protect people from those potentially infectious droplets. So the recommendation would be that everybody wears a cloth face covering or a mask. And that can be really any sort of cloth face covering that you can make at home or that you can buy in any store. And I really want to differentiate that from a surgical mask that we wear in a hospital or an N95 mask. Those types of masks are not needed in the public, and really it's important that we save those masks for frontline workers and healthcare providers, especially as we do see cases starting to surge, and we need to make sure to have those types of particular masks available for those workers so they have them available to protect themselves in the hospital. But I would definitely take a look at both the CDC and WHO websites. Also make sure to be attuned to what is being recommended in your local state and local governments, because some places are now requiring mandatory cloth face coverings and mask use in your area. So I would recommend people pay attention to that.
It's really helpful, thank you. Also wondering about vaccines to prevent COVID-19. Can you give us an update about the development of vaccines? When should we expect one to be available?
Yeah, that's another really great question. So first off, I wish I had a magic crystal ball and I could answer that question. I'd probably be a billionaire. I know that there are numerous vaccine initiatives ongoing right now, both in the United States and globally. And there's numerous different candidates and types of vaccines being looked at. I think that in a best case scenario, if everything goes well and perfectly according to plan, we could potentially have a vaccine candidate towards the end of the year, early 2021. So that would be best case scenario. I think that hopefully by sometime next year, but we'll have to wait and see. That's probably the best information I can give you at this point.
Kind of going along those lines of looking into your crystal ball, how effective do you expect the COVID-19 vaccine to be, or is it just too soon to be able to speculate?
Yeah, I think that's going to be too soon to speculate. I think that, again, it's going to depend on the type of vaccine and other variables. I think that they're doing some phase 2, phase 3 studies. I think we're still also learning about the immediate and long-term immunity of COVID-19. And so those are really great questions and things that we're still also learning about the virus itself. As I mentioned earlier, I know it feels like we've been living with COVID-19 forever, but we've only known about this virus for about 6 months now. And so that's still very early days of the virus. And quite frankly, if we are to get a vaccine later this year or early next year, that would be astronomically quick for a vaccine. And one of the things I do suspect that will happen, that I believe also numerous other scientists have said, including Dr. Fauci, is that we probably will end up getting a couple different vaccines, and they might work in different ways. And so that would also be something else to maybe keep your eye on. So I think that we'll just have to wait and see.
Earlier this week, the CDC issued new guidelines about people who are at higher risk for severe illness from COVID-19. And those guidelines indicate that those who are immunocompromised in connection with organ transplants are at an increased risk, and that people who have liver disease or who are taking immune weakening medicines may be at increased risk can you comment on this new guidance at all?
Sure. I think that some of that guidance that came out, at least to myself, was not terribly surprising. We know that people that have weakened immune systems may not be able to mount as an effective of an immune response. And so that makes some sense to me. I think that particularly the information about people who have liver disease, one of the things that came out in that guidance is that people who have things like cirrhosis would be the people that we'd be most concerned about. And that makes sense because those are the people who have advanced liver disease, and people who have organ transplants, again, tend to be on immune suppressants. And overall, looking at the information that came out, it really is the people who have more suppressed immune systems, right? So people who, have more advanced sorts of diseases are the ones that we're going to be more concerned about. And even one of the things that I actually found to be most notable in that updated guidance was they really made a point to clarify that when it comes to the age stipulation that they had previously made, they really made a point to say that anybody at any age, but increasing age, are the people that can be at risk for COVID-19. So they really want people to stop focusing on, an age cutoff. They really want you to say increasing age puts you at risk for COVID-19.
Thank you. The CDC director recently said that he believes for every COVID-19 case that's been reported, there are likely 10 other infections that haven't. Can you comment on this and any other information related to the proportion of coronavirus cases that are due to asymptomatic spread?
Sure. So, what I think Dr. Redfield is saying is that a couple of things. So I think number one, I think that at least the way I interpreted it is that I think that we still have a long way to go in terms of testing. We need to do more testing. Again, there's people who we know that have been infected that we just don't know. They were infected and they asymptomatically seroconverted. So I think that as we continue to do testing and we learn more about the disease, we'll find out more about people who've been exposed and seroconverted. And we're still learning more every day about asymptomatic disease and pre-symptomatic disease. And that's a lot of what we still are trying to find out more about in terms of the transmission dynamics of the disease to try and better inform policy and recommendations that we're making.
That's really helpful. And I think it's kind of speaks to mask use as well. Like you pointed out earlier, assuming that everyone has COVID-19 when you're out and about and ensuring that you're taking every precaution. We recently tried something new in our Autoimmune Hepatitis Association private Facebook group. We polled our members and asked them 3 questions related to COVID-19. One of those questions was around activities that patients will consider participating in the next month or so. Most said they would go to doctor's appointments and go grocery shopping, but only a few said they would attend indoor religious services, outdoor games like baseball or soccer, or an indoor movie. When evaluating whether to participate in activities this summer, it seems like top considerations include the size of the crowd you'll be in and whether the activity is indoors or outdoors. Are these important considerations and anything else we should be remembering to think about when evaluating risk?
So first off, I want to say that I really agree with all the members of your group, and I'm happy to hear that they've been listening and paying attention to the public health experts and all the information that's out there. Absolutely, you need to be thinking about whether or not the activity will be indoors or outdoors. You need to be thinking about the size of the group that will be there as well, because you don't want to be around a lot of people. I think the other things you do need to think about would be your own personal risk, right? So one of the things that I would think about is, what medical comorbidities do I have that put me at risk? I would also think about the people that I'm living with. right? So it's not just about me, it's about the people that I'm around and their risk factors. And I think that sometimes people, not on purpose, but they sometimes forget that. So I might be healthy, but I might live with my elderly sister, mother, brother who might be sick. And so I might get COVID-19 and I might not feel sick, but as we know, and you just mentioned, people can have asymptomatic disease, they can have pre-symptomatic disease. And we do know that in the pre-symptomatic phase of COVID-19 is when your virus level is the highest and you are the most infectious. And so in that time, you could potentially transmit the disease to your immune compromised family member that you're living with or friend that you're living with. And so I think those are things that you really do need to think about. And I do think that really, again, given everything that's going on right now, it is really important to stay as close to home as possible. And it makes sense to really only be going out for necessary things. So the doctor's appointments, if you need groceries, that makes sense. But we really want to try and encourage people to stay home as much as possible.
Some patients have said that the only thing they would leave the house for is an urgent doctor's appointment. One member wrote in and said she basically has zero risk tolerance and she's really concerned about communities opening back up. She's curious if her cautious approach is wise or whether she's being too cautious, if that's even possible during a pandemic. What's the right approach, do you think?
Well, I'm never going to tell anybody exactly how to feel, right? So I think everybody has a different level of risk tolerance during this time. You know, that being said, I obviously also don't want people to not be going to the doctor if they need to. And, you know, we have seen that also become a problem, not just in this pandemic, but in other pandemics. That can also become a problem. So we want people to get medical care if they need it, and we want people to get the things that they need. So I would also caution people not to go to the other side of the spectrum. So, you know, one of the things we worry about is, you know, people who maybe need life-saving vaccines and things like that, maybe not accessing the medical care that they need. So there does need to be a fine line between being cautious and not being overly cautious and not getting the medical care that you need. One of the things that I think is extremely important that we've been trying to get the message out about is with the upcoming flu season is making sure everybody gets their flu shot for people, especially in the autoimmune hepatitis community, making sure that their pneumavax and their Prevnars are up to date. We don't want people, you know, potentially getting influenza or pneumococcal infection because they didn't get their appropriate vaccines. Likewise, in the younger population, we don't want children getting things like measles because they're not getting their MMRs. So it is important to access appropriate medical care and not stay away from the doctor because you're too scared. So I think there's a right level of caution to have. That being said, I don't want people, I never want to tell people how to feel because that's a very legitimate feeling.
Another one of our poll questions asked members how worried they are about contracting COVID-19. Most who responded said that they're worried, but they're confident in the precautions they're taking to protect themselves, or at least as confident as you can be during a pandemic. But some noted that they are worried to the point that it's negatively impacting their mental and or physical health. You've responded to a number of infectious disease outbreaks. Is it common to see things like anxiety and depression during and after infectious disease outbreaks? And what about post-traumatic stress disorder?
Yeah, that's a great question. So first of all, yes, it is very common for people to develop anxiety and depression during these times. And I think especially in this particular situation where we have, you know, had to institute things like lockdowns and quarantines and, you know, this has become part of our 24/7 news cycle. And I definitely think that we've seen plenty of studies with infectious disease outbreaks where it can cause some post-traumatic stress disorder. And I think it's really important for people who are starting to feel that way, especially as we, move into the 4th, 5th month of this being in significant impacts here in the United States, for people to really start to think about how they can take care of their own mental health, because we don't want that to become an issue. And, I think that for people who are beginning to feel it, if they haven't already, it's really important to try and limit your amount of time that you have exposed to the news. One of the things I tell people is try to pick 1 or 2 news sources that you follow and look at it only once or twice a day. Don't do the 24/7 constant exposure to the news. I also have told people to do things like make sure you have a support group or people that you feel comfortable reaching out to. This is a really good time to try and actually reconnect with family and friends. And I think that can be helpful. I think journaling can be helpful, trying to just keep track of how you're feeling. I also have, said to people that it can also be a really good time to kind of pick up a new hobby. There's a lot of great things online these days, free classes that you can take online, free courses you can take. It's a good time to try and do something new. But I think those are a couple of things that I try and recommend to people to try and keep their mental health in check. And I think there's also a lot of really great online support groups these days as well.
The second webinar in this COVID-19 Frontline Report webinar series that we're putting on focused on ways to cope during the pandemic. So we would really encourage anyone who's struggling to go back and watch that webinar, which is on our YouTube channel. And we'd also encourage anyone who's experiencing anxiety or depression to seek out medical care from their doctor or to seek care from a therapist. I've noticed that most providers are offering online options for visits now, virtual visits, so it's a great time to take advantage of those opportunities. Back to a few other questions. Movie theaters are reopening. Is it okay to see a movie if I wear a mask?
So I think, again, this is one of those situations where you need to think about your own risk tolerance. I think that if you want to go to a movie, I would think about, when you're going to that movie. I would try to go during an off hour. I would definitely wear a mask, and I would try to, keep as much distance as you can between you and other people. I would definitely not go to a movie where it's going to be a packed crowd of people, because that's just going to increase your risk of getting infected.
You mentioned earlier about not being too cautious during the pandemic, that you don't seek out medical care when you really need it. One member wrote in and asked about routine dental cleaning. She has one coming up, and she said she doesn't have any issues. She doesn't urgently need to see the dentist. This is just routine, her 6-month visit to get her teeth cleaned. She's wondering, should she keep her appointment or should she postpone it?
Yeah, that's a great question. That's one of those ones where, honestly, I would talk to my dentist, because you want to make sure your dentist has also implemented the appropriate and correct infection control measures at this time. There have been new measures that have been advised to dental practices given the coronavirus outbreak. So having your dental cleaning is considered an aerosolized generating procedure. And so I would want to know that my dental office has now implemented those correct procedures and policies. And so I would check with them, make sure that they've implemented those and understand what those are before I would go ahead and proceed with my dental cleaning.
Thank you, that's helpful. Earlier you talked about grandparents visiting grandkids again. We had another member write in and asked, when is it okay to visit my elderly parents?
Yeah, so I think that I would use the same guidance that I gave for the grandparents. I think I would have to think about my own risk factors, to think about, okay, well, what have I been doing? Have I been staying at home? Have I been hunkered down? Who have I been around with? Have I been going out? So I would want to know what my risk factors are. I would also want to know what my parents have been doing. Have my parents been staying at home, or have they been going out and about, and have they been around other people? And also think about what my parents' medical comorbidities are. So it's really hard to give one overall general recommendation. You really need to have some critical thinking when you make those decisions. So thinking about your own risk factors, thinking about your parents' own risk factors, and then again, risk tolerance, and also how far away do they live? You know, or am I going to have to travel? Those types of things.
That's helpful. And I think for any activity this summer, it seems like it's coming back to evaluating your own risk factors and thinking about it critically for your own unique situation. As we wrap up, is there anything we haven't talked about that's important for patients to keep in mind as they think about how to continue to live their lives during the pandemic?
You know, I think the only thing that I would continue to caution people about is, you know, some of the things that we've mentioned already. We're still in the early days of this pandemic, even though it doesn't feel that way. The science is not static, it is ever changing, and what we know today will be different than what we know in a month. And I think that myself, like the other people in my field, we think that the best tools that we have at this point are the ones that maybe don't sound very glamorous, but are tried and true. So again, the physical distancing, staying close to home, washing your hands, being vigilant about hand hygiene, being vigilant about your respiratory etiquette. If you're coughing, cough into your elbow, and wearing a mask, staying at home if you're sick, and self-isolating. Those things are the tried and true things that we think will get us out of this lockdown, hopefully get the cases down in the United States as we continue to try and learn more about this infection and develop therapeutics and other medical countermeasures and vaccines to hopefully treat people. So, you know, I think the only thing I can say is that I really urge people to use these tried and true measures and try and educate other people to use these tried and true measures as we continue to go forward into the fall, winter, and coming months of this pandemic.
Thank you, Dr. Kuppalli. It's been wonderful to have you back with us again this week, and your advice and perspective has been invaluable. Thank you again.
Thanks for having me. I appreciate it.
Thank you, and I'll now turn it back over to Dr. Lammert.
Thank you, Erin and Dr. Kuppalli, and thank you for joining us today. A very special thank you to Dr. Kuppalli for joining us again and really letting us ask you anything about this pandemic. Thank you to the collaborators of the AIHA, specifically the Center for Autoimmune Liver Disease and Cincinnati Children's Hospital. We hope you'll join us again for our next webinar.